Did you know that a major modern healthcare network can easily manage literally millions of patient interactions, coordinate tens of thousands of staff members, and process petabytes of secure data every single year? It's a staggering scale. Okay, let's dive into this. Welcome to this explainer. Today, we're looking at the invisible architecture that keeps all that massive scale from just collapsing under its own weight. We're breaking down the strategic frameworks for program management in healthcare. Now, to truly understand this, I want you to imagine a healthcare organization not just as a standard business, but as a highly complex biological system. Think about your own body, right? You've got billions of moving parts, cells, tissues, and organ systems that all have to communicate instantly and flawlessly just to keep you alive. Well, a healthcare network is exactly the same. You have hospitals, satellite clinics, digital networks, administration, and frontline staff. When they don't communicate, the system gets sick. But when they are managed properly, the entire system absolutely thrives. Let's look at exactly how that management happens.
How do hospitals survive the intersection of care, compliance, and tech? Because, listen, right now, healthcare environments are operating at a breakneck, honestly almost terrifying pace. We have patient outcomes demanding immediate life-saving attention. Then, regulatory compliance requiring absolute uncompromising legal precision. And on top of that, technological innovation advancing faster than ever before. These three massive forces are crashing into each other every single day. Just picture this. You've got a top surgeon who absolutely needs a brand new AI diagnostic tool deployed immediately to save lives. But simultaneously, the IT department is completely locking down the servers to meet a strict new federal compliance mandate, all while the ER downstairs is completely overflowing with a seasonal spike in patients. That isn't just a stressful Tuesday. Without structure, it is a recipe for absolute chaos. The pressure is immense. So how does an organization not just survive this massive collision of forces, but actually navigate it successfully?
And this brilliantly illustrates the core of the issue. When a system is fragmented, it acts just like an autoimmune disease. You literally have different departments inadvertently fighting against each other. You might have one team aggressively rolling out a new scheduling software while another team, completely in the dark, by the way, is changing the fundamental patient intake protocols. It's inefficient, it's incredibly frustrating for the staff, and frankly, it's dangerous for the patients. Conversely, an aligned system acts as a healthy, fully functioning central nervous system. Everything is coordinated. Every single impulse, every new initiative, and every structural change is acting in complete harmony. The difference between fragmentation and alignment is quite literally the difference between a failing, chaotic hospital and a thriving, resilient healthcare network.
So how do we actively move from that fragmentation to perfect alignment? Well, the answer is program management. As the source material defines it, program management provides the structured oversight needed to seamlessly coordinate initiatives. Think of it kind of like the master air traffic control tower for a massive international airport. The tower isn't flying the planes, but it is ensuring that thousands of simultaneous, highly complex movements happen without a single collision. In healthcare, this is your stabilizing force. It's the practice of ensuring that localized projects across physical hospitals, outpatient clinics, and digital platforms are intimately connected to the ultimate strategic goals of the entire organization. Program management is what steps in to ensure that patient care, compliance, and technology adoption aren't just a bunch of random, siloed projects, but rather a unified strategy delivering improved outcomes.
Now, what's really interesting about this slide is how we can break this massive biological system down into functional areas. According to the research, program management operates through 5 distinct vital applications. You can think of these as the 5 vital organs of our healthcare body: patient care improvement, digital health platforms, regulatory compliance, operational efficiency, and innovation in care delivery. Every single one of these is absolutely critical. If one organ fails, the entire system is put at severe risk. Let's take a focused look at how structured oversight actively manages each of these vital organs to keep the entire organism alive and well.
The absolute heart of the matter is patient care improvement. Program management here is about aggressively driving initiatives that directly impact the person sitting in the hospital bed or pacing in the waiting room. We aren't just talking about abstract administrative theories. We are talking about highly coordinated programs that optimize workflows right now. For instance, managing a massive system overhaul so a patient isn't asked for their identical medical history by 3 different nurses in the span of a single hour. It's about structuring treatment protocols so patients heal faster and slashing wait times in the emergency room through better triaging software. It is the rapid-fire implementation of structured programs that immediately elevate the standard of care, ensuring every single patient is treated efficiently and accurately. Let's move to and see how this builds into our next vital application, digital health platforms. If patient care is the heart, digital health is the complex neural network. Program management is the intelligence that coordinates this vast invisible web of technology across all facilities. Think about the sheer logistical complexity of unifying electronic health records, or EHR. Because of structured program management, a specialist in a tiny, remote clinic can instantly pull up the exact same high-resolution chart and history as the lead surgeon in the downtown metropolitan hospital. And it goes even further, managing the integration of highly complex telemedicine portals and cutting-edge AI-driven diagnostics, ensuring all these distinct platforms talk to each other seamlessly without dropping a single packet of critical patient data.
But, as we know, a neural network is incredibly vulnerable without a robust immune system. And that brings us to regulatory compliance. This protects the organization from severe external and internal threats. The healthcare landscape is incredibly heavily regulated, and the stakes, they are extraordinarily high. Consider this surprising fact. A single tier of HIPAA violations can carry fines up to $50,000 per incident, potentially maxing out at over $1.5 million a year for identical provisions. Program management provides the rigorous, uncompromising oversight absolutely required to ensure total adherence to these laws. It navigates complex local health codes and ensures that strict accreditation standards are universally maintained across dozens of disparate departments, protecting both the patient's privacy and the hospital's very existence.
To keep all of this alive and functioning, you need a highly efficient circulatory system, operational efficiency. Healthcare is incredibly resource-intensive. Program management tackles this by actively overseeing resource allocation, making sure a hospital isn't stockpiling expensive equipment it doesn't need while simultaneously running out of critical basic supplies like saline drips. Most importantly, it drives workforce optimization. By using data-driven programs to predict patient volume, staff can be deployed exactly where they are needed most. This prevents the very human, very real crisis of nurse and physician burnout. By organizing these logistical arteries, program management directly serves to reduce massive overhead costs while keeping the quality of care exceptionally high.
A healthy organism doesn't just survive its current environment, though, it evolves. That is where innovation in care delivery comes into play. Program management is the engine that pulls the organization's heartbeat forward into the future. It does this by carefully coordinating complex, multi-phase clinical trials and overseeing the safe, measured adoption of brand new medical technologies. We're talking about managing the rollout of million-dollar robotic surgical assistants or deploying hospital-wide continuous remote vitals monitoring. Without structured program management, adopting that kind of innovation is just a highly expensive, risky experiment. With it, innovation becomes a reliable, safe pipeline that constantly upgrades how modern medicine is delivered.
So, the crucial point is this: when you apply the cure of structured oversight and strategically align your initiatives, you actively prevent the disease of organizational fragmentation. You stop executing random, disconnected projects and start executing a unified strategy. And the results aren't just corporate jargon. By deeply integrating program management, healthcare networks achieve highly measurable patient outcomes. They build a profound operational resilience that can withstand unexpected shocks, like supply chain failures or sudden surges in patient volume. And above all else, this alignment builds deep, lasting trust with the patients who are relying on the system on the worst days of their lives.
The healthcare landscape is endlessly demanding, and it is evolving by the minute. We've seen how structured program management transforms a chaotic, fragmented environment into a highly efficient, living, breathing system that operates in total harmony. The tools are there, and the strategic framework is crystal clear. So the only question left to ask yourself is your healthcare organization merely surviving the evolving landscape, or are you strategically aligned to truly thrive? Thank you so much for joining me for this explainer. Keep learning, stay curious, and I'll see you next time.